I met Jerome Adams, Trump's first Surgeon General, and I asked him about this. And he said that overall, the government favors the right of a corporation to make a profit over the health of Americans. But it's like Mike Tyson said, everybody has a plan until they get punched in the mouth. And so what do you do when things don't go right? Well, most people just quit. And I wanted to show the world that pharmacists are healthcare professionals and have a very distinct knowledge set that can benefit patients.
On my LinkedIn, I said, when you stop seeing yourself as just a pharmacist and start seeing yourself as a healthcare innovator, your career will shift too.
The profession, I think, is most capable of and has the infrastructure in place already to step up and help fill that gap for primarily disease prevention are pharmacists. Most people, when they don't succeed at what they're trying to do, it's not for lack of trying, it's for lack of execution. And lack of execution comes from an inadequate plan.
Today, I have the pleasure of speaking with Dr. Richard Harris, a dynamic healthcare professional who seamlessly blends the worlds of medicine and pharmacy. With dual doctorates in medicine and pharmacy, as well as an MBA, Dr. Harris is a board-certified internal medicine physician and the founder of Great Health and Wellness. Beyond his clinical expertise, he's the co-founder and chief strategy officer at Nimbus Healthcare and the chief medical officer for Scripted, pioneering advancements in telemedicine and patient care. Dr. Harris, thank you so much for joining me.
Oh, thank you so much for having me on the podcast, Nima. It's great to connect with you and see our different journeys and where we are now and how we were 4 years ago. It's great that social media has allowed us to stay connected and follow each other.
A lot has changed. Like you said, I had the pleasure of having you on the podcast 4 years ago. And as we were talking before we started, a lot has changed in our personal lives and in healthcare. So let's get right into it. But before we get right into it, we got to give a shout out to your mom, because if it wasn't because you're a mom, you wouldn't have really become a doctor, because she's the one that gave you the book Gifted Hands by Dr. Ben Carson. And that book is the reason why you pursued it wanting to become a doctor. And I read that you mentioned that you were on a mission to make doctors respect pharmacists. That was one of the reasons why you wanted to pursue medical school, because as we've talked before, 4 years ago, you went to pharmacy school first and then medical school.
Mm-hmm.
What made you pick that as your mission after going through pharmacy school? Was it an interaction that you had? Was it something that was said? Because as pharmacists, we say that. I think we've advanced a lot as far as getting the respect of doctors. But what made you give that mission to yourself back then?
Yeah. So super cool story. Since last we talked, I actually got to meet Ben Carson and shook his hand. And I told him he's the reason I became a physician, because I read Gifted Hands. And I saw his face just light up. And that was such a super cool moment for me. And I actually got an autographed book from him and I gave it to my mom. So
that's beautiful. Full
circle moment. That's one of those special moments I'll remember for the rest of my life. But yeah, going through pharmacy school, I realized in pharmacy school I wanted to go to medical school, but I loved what I was learning in pharmacology. I loved the skills, the leadership, how to evaluate clinical research, and actually being at a research-focused institution, I was learning from people who were world-class at the forefront of new technologies and new drug delivery and methodology in pharmacology and pharmacokinetics and pharmacodynamics. And when I got into wards our fourth year, so a lot of people may not know this, but pharmacists are actually among medical students and physical therapy students and dietitians and all of those students. When we go out in our fourth year and we're going out into the hospitals and the community and we're working with other healthcare professionals, I really felt like the pharmacists at that time were not getting the credit that I thought that we were due. Our knowledge base was not being taken advantage of like I thought it should be. And part of me did it because I knew I'd be mad at myself if I didn't go back to or go to medical school. part of me wanted to do it because I knew what myself and my friends were capable of, and I wanted to show the world that pharmacists are healthcare professionals and have a very distinct knowledge set that can benefit patients. And it's funny, when I got into medical school, I was actually working as a pharmacist. People were like, "How the heck are you working?" And I said, "I've done a doctorate level program before. This is not new to me. I know it's expected. I know the workload. I know how hard it's going to be. I know how to study." Right? This is, for me, it's just like riding a bicycle. I'm back in the saddle and I know what to do. And then we got out in residency. My first year, people were like, "Oh, you're the pharmacist, right?" Even the attendings. "Okay, what should I do about this patient?" And so I had a lot more trust immediately. And people told me, even in my first year of residency, that I was operating like a third year resident, that I was operating like a professional, a fully licensed physician, an
Yeah.
autonomous physician. And that was all because of my background in pharmacy.
Yeah. Last time we spoke, I mentioned you have an MD, obviously PharmD, MBA. Last time we spoke, you joked about around how there's a poll going around whether you would get your JD. And that was 4 years ago. I checked, and I don't think you've got the JD yet, but you are the chief medical advisor for Hawk Law. I believe that's how you say it, HAQUE. I'm not
Yeah.
sure if you're still in that role, but I saw that if not, if you're not currently in that role, but you were at some point. So you did pursue some sort of JD path role. How was that experience of being the chief medical advisor for that law firm?
Yeah, it was really interesting because you got to look at cases from a different perspective. Because, in pharmacy school and medical school, you do have a legal course, but you're more talking about compliance and things to make sure that you don't break any rules as a practitioner. This was more so looking at things from both the medical perspective and the patient perspective and the legal perspective. So, being able to converse with a lawyer who was well versed in healthcare law. He was the chief legal officer for a large hospital organization before he left to start his own firm. It was just really a unique experience in learning about how these things work from a medical legal perspective. And I found it interesting to review these cases and see, okay, is there something that's actually there? Did the physician not meet their burden of taking care of that patient in a way that they should have? So I found that experience unique. I'm not doing it currently, but I did find it enriching.
Did it ever spark a little interest back to pursue that JD? Because if people are not following you on social media, you do love reading. You read about 2 to 3 research papers a week, I think you said before in the past. So, and I know law partakes a lot of reading books. You got to read, 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 stay up to date, and you're already doing that. So, did it ever spark an interest of, or was it like, this is not for me?
I think so. There is a future where I go to law school,
Okay.
and it would be after the current things that I'm doing are done, right?
Okay. Okay.
Businesses have cycles, right? And my life has operated in cycles. And so I'm really happy with what I'm doing currently. But eventually, there's going to come a time point where this cycle ends. And it's going to be, what am I going to do for the next cycle? And I'm really interested in healthcare policy. And I think that a lot of the people who are writing laws about healthcare, they've never worked in healthcare. And I've worked in healthcare for multiple different avenues. And I really want to be able to help, from a legal perspective, patients and physicians and pharmacists get that relationship back to where it used to be, to where it was a beautiful thing, the relationship between a patient and a physician or a pharmacist or the physical therapist or wherever, where you were really just focused on, how do I get this person better, and not having to deal with a lot of the administrative burden and all these other rules and regulations that are not helping patients, they're not helping physicians, they're not helping pharmacists.
It's funny you said how, there's a lot of people making healthcare policies that were not ever practicing in any sorts of healthcare. A common theme that keeps coming up in these podcasts. In the past couple of podcasts, I've had physicians, healthcare professionals on, and the common thing is that there's a lot of companies, especially now with technology, that are being created that are healthcare related, but the founders, or even the CEOs are not healthcare background. And it's like the direction of these companies are going the wrong way because they don't really have the knowledge or experience of what really do the patients need or want. It's more looked at as a money grab type of situation. Would you agree with that?
Yeah, so it's one thing to look on the outside of a problem and think you know how to solve it, than actually be in the trenches with that problem and know how to solve it. So, one of the things I'm really proud about at Script Health and Nimbus is that it was founded by pharmacists. So, we are pharmacy companies who are founded by pharmacists. And that I think that's really, really important because we do have people who have healthcare and business experience, but at the end of the day, when you're a healthcare provider, the number one thing you're thinking about is how can I make patients' lives better? That's it. That's the number one thing you're focused on. Now, of course, as operating as a business, you need to make money. But if we're going to make money, we're going to do so because we're actually doing something to improve the healthcare experience.
So talking about profits and everything, obviously corporate profits and America being the to only one of the two countries in the world that can have pharmacy medication advertisements on TV. I feel like the corporations and profits are put at a higher pedestal than patient health. For example, I think you posted about this yesterday on Instagram in regards to the White House withdrawing FDA plans to ban menthol cigarettes. So it seems like that's a huge money grab there. That industry is a huge money grab, but obviously it's not beneficial. It's addicting, like that flavored of these all these cigarettes is just more addicting for whoever is consuming them. Why do you think? Do you think we'll ever get to a point where the patient care is at least leveled with the amount of money or how much profits there is in something? Or do you think it's just gonna we won't really be able to see that in our lifetime because a lot has to change?
Yeah, a lot has to change. I mean, you look at tobacco, extraordinarily powerful. Pharma lobbies, extraordinarily powerful. Some of the food and beverage lobbies, extraordinarily powerful, right? And these are people or organizations that are giving millions and millions of dollars to political figures, right? And so this could have been a watershed moment. Everything that the administration beforehand said that they were going to do for health, this could have been okay. You put your money where your mouth is, right? Like literally, the menthol ban could have been a huge win for patients because if you look at what happens with menthol cigarettes, it makes up a significant portion of tobacco revenue, 37% of the revenue. And it's been shown repeatedly that they predatorily market towards communities of color, low income communities. And these are the communities that are most vulnerable. We know as healthcare providers, the social determinants of health, your environment is extraordinarily powerful for your health. So now we have a high risk group that's getting predatorily marketed for products that we know. I don't think anyone out there today would say, okay, smoking is beneficial for your health, right? We know conclusively that smoking causes cardiovascular disease, causes cancer. And so it could have been a huge win for the healthcare community, showing that this administration is serious about tackling this chronic disease epidemic. Another thing is alcohol. Alcohol sales went through the roof during the pandemic. Luckily, they're coming down, but that's another area where the government could institute policies to help significantly improve the health of Americans by more regulation on some of these big businesses in tobacco and alcohol, yet we're not seeing that. I met Jerome Adams, Trump's first Surgeon General, and I asked him about this. And he said that overall, the government favors the right of a corporation to make a profit over the health of Americans. And until we get out of that mindset as a country, it's going to be very, very hard for us to turn around this chronic disease epidemic.
I feel like when e-cigs became a thing, I don't know exactly what year it was. It might have been like, I want to say like 2009, 10, maybe before that. It was like it became like a thing. I thought it was marketed towards like, hey, if you're like a smoker, you use this and eventually stop smoking. Like you use it as a way to get out of smoking. And then eventually there was a shift where these e-cigs became flavored and now it became more so of like, oh, instead of smoking cigarettes, you could just do this because it's a water vapor or whatever they market it as. I don't know where that shift came from, where now they became, oh, I wonder if that was like a plan where like they marketed as a way to stop smoking cigarettes and eventually get people hooked, or it's just something that just happened over time.
Yeah, I think it was a concerted effort to increase sales. So if you look at smoking by age, between the 40, I think it's 45 and 69, about 15, 16% of those individuals smoke. And if you look at 18 to 24, it's only 5%. So tobacco companies see this and they're like, whoa, we're going to have think about it, 1/3 of the amount of smokers in the pipeline. It's going to cut our profits tremendously. So how do we get younger people into tobacco? Well, they're more electronically savvy. We can gamify this, make it colored, lights, all that type of thing to more attract younger people. We can flavor it, right? And so we know that looking at some of the data that yes, e-cigarettes can help people stop smoking, can be used as a transition point to eventually being, tobacco and nicotine free. However, a lot of people stay there. They go from the cigarettes to the e-cigs and then they don't transition off of that. And then of course, because it's a different delivery mechanism and there's some different um, products involved in how you combust them and the ones that are not water vapor, we don't know the long-term effects. It could have completely different effects than actually cigarette smoking on the lungs or other organs. So, I think that in some cases it can be a positive. In some cases it could be a negative. It just really depends on how it's used. And of course, who is it marketed towards? Are they using the same predatory marketing techniques that they've used before?
Yeah, I think like you said, it's all about your mindset of going into it. Because imagine if someone's already smoking cigarettes, they're pretty much probably we could say they're addicted to it because it's very hard to come off of cigarettes. It's a mental thing to me. And if you're not mentally ready to challenge yourself and say that, hey, I'm gonna get on this and eventually come off, then it's just gonna go in a full circle. um, so you're not only a physician pharmacist, but you're an entrepreneur. And when I found this fact, I was like, "What? How he does this?" And what I'm talking about is, did you ever think you would own 20% of a paper factory in Africa? And tell me what that is about.
No, I did not. I have a good friend who is in the logistics business. He used to run logistics and sand for Chevron and some other oil and gas companies. And he met a guy and he was starting up this paper factory. Um, and so we looked at the business model and I thought it was something that was intriguing, not only from a perspective of renewables, but also from a perspective of employing people in Africa, right? So the coolest part about being an entrepreneur, at least for me, is in the companies that we have that we're able to provide a living for somebody else. That's the coolest part. The freedom is nice, to be able to work on things that you want to work on and things like that. But as your company grows, you get less freedom. So you have to be able to figure out, why am I still doing this day after day, right? Because if you have a board, you have shareholder, you have all that kind of stuff, you're no longer actually in charge of your company, right? So I think that the coolest part is being able to provide a living for somebody's family, watch their families kind of grow and be successful in the business and outside of the business. That to me is what gets me going every day as an entrepreneur. And then, of course, being in healthcare is trying to make the system suck less, right? How do we make it easier for both physicians, pharmacists, patients? That's something that is my driving force into why I went into healthcare entrepreneurship and even other types of entrepreneurship.
Making changes into healthcare, it takes so long. I feel like anything that would take in any industry like 4 or 5 years, in healthcare will take like 30 years for you to wanna change it. So, what challenges have you come across with Nimbus, with Scripted, where you're like, "Oh, this is such a great idea. I know this will go," but obviously it's not something that you could just implement tomorrow. It's something that you have to start, little by little and eventually hope for the fact that it will become a thing because especially with AI technology and everything right now, like something today could be looked at as no way Jose. And then in 30 years, they're gonna be like, wow, this is the greatest idea in the world. So it's like,
Mhm.
how do you approach that as an entrepreneur, as a co-founder of these organizations?
Yeah, so we've encountered more challenges with scripted than we have with Nimbus in this regard because with scripted, we knew we were early. We knew that the market was heading towards where we were going, but it wasn't quite there yet, especially, 4 years ago. It's slowly every single quarter, it's getting a little bit easier. The conversations are getting a little bit easier. We had some innovators that were ready. They were willing to go, and they were easy conversations. Then we had some early adopters, and those were slightly harder conversations, but they were still eager and ready to go. And now we're getting into the early majority, is where we're getting a lot of pushback. And it's mostly because these are pharmacists who never envisioned themselves as more. They never envisioned themselves as practicing at the top of their licenses. They never envisioned themselves directly involved with patient care as a prescriber, right? As a diagnostician. Those are being a prescriber, being a diagnostician, and talking to people about their medications are completely different mindset. And I understand this because I'm someone who's made that transition. So I've been able to, as we built out Script Health, try to put in the tools to help with that transition, because I realized that that was going to be very important. So now we're having these conversations with these people who are in the early majority, and it's really about giving them support and tools to be able to transition from what they were before into where the market is going. Because you and I both know that the old days of standing behind the counter, counting pills by 5 are dead. That business model is dead. It's not sustainable. It's if that's all you're doing in pharmacy, you're slowly bleeding out, right? Even the big companies are slowly bleeding out in that model. So that's really been the biggest challenge where we are now. Before, it was proof of concept. People just didn't believe it. Now it's more, okay, we know this is coming. How do we empower these pharmacists who never envisioned this to step into where the profession is going?
Two-part statement, comment, question. Why do you think it's so hard, or why is it so much harder for pharmacists to really see that vision? I tend to see that a lot, even if I work at a hospital setting right now, and when you speak with other pharmacists, they don't really see that vision that you're talking about. And like my LinkedIn content is all about this, about, hey, pharmacists, you need to do this, think about it this way. I literally posted 3 hours ago on my LinkedIn. I said, when you stop seeing yourself as just a pharmacist and start seeing yourself as a healthcare innovator, your career will shift too.
Hmm.
It's like, I don't think that thought process is really common to see in pharmacists. Why do you think that is?
I think it starts in school.
Yeah.
So I think that when you're in medical school, the whole mantra is your future is open for you. There are numerous different ways you can practice as a physician, whether that's research, patient care, being a medical science liaison, lobbying. You have physicians doing all different things straight out of the gate, right? Whereas in pharmacy, I went and talked to the University of Houston pharmacy students kind of about the same stuff that we're talking about today. And they were just looked like wide-eyed, right? That this is like the first time that someone's come to them with these concepts, that there's more in the area of pharmacy than just working at like a community pharmacy. And I'm not saying there's anything wrong with that. We need community pharmacists. A community pharmacist can be an absolute game changer as a healthcare provider. Community pharmacists can save lives, catch interactions, make recommendations to physicians. You can absolutely be impactful. But there's other avenues out there if that's not what you want to do. And pharmacy is at a time period where a lot of people are preaching doom and gloom. And I see it as a period for us to really take control of the narrative and become whatever you want to become inside of pharmacy, whether that's medication therapy management, whether that's genetics. Pharmacogenetics, that field is huge. It's going to be massive. Precision medicine is another category that we're seeing a lot of interest in. Pharmacists will absolutely be involved in precision medicine. And then you see all these health tech companies coming up in the pharmacy space. There's opportunities there. There's opportunities for medical writing. I think one of the biggest problems in our current system today is the lack of transmission of information from the professionals to the patients in a manner where they are. So when someone comes into the physician's office, I believe I saw something like they forget 50% of what you say within 24 hours and 70% of what you say within 48 hours, right? So how do we get this information that's critical to them just in time, right? When you're in business school, you study Toyota and their just in time manufacturing. Well, how come we don't have that in the same using technology right now where we're getting information to people when they need it, where they are? So this is just a few of the opportunities I think that are out there in the profession of pharmacy.
So many people in pharmacy are so against talking negatively about community pharmacy, and I'm just the total opposite of that. Like, I started my career in community pharmacy and transitioned into a hospital and then the nursing homes. And I think community pharmacies is the one that we need to preach the most because they're the most accessible healthcare professionals. The reason why pharmacists are known as the most accessible healthcare professionals is because of community pharmacies. And I envision the community pharmacies to be like the healthcare hubs of the communities in the future. As we spoken, like dispensing medications is going to be long gone, right? That's not going to be the model of community pharmacies. I believe community pharmacies will be turned into health hub clinics where pharmacists are running them and they're doing preventable measures, they're doing chronic disease management, they're doing medication therapy management, and all that dispensing stuff is going to be handled by technology, right? I don't need a technician to count pills and put it in a bottle. I can just have a machine do that for me and have me focused on preventable care, precision medicine, medication therapy management, like we've discussed. That's where I envision community pharmacy going. And I feel like we need to stop putting such a negative connotation behind community pharmacy and scare pharmacy students from going into community pharmacy because we need innovators to go into community pharmacy to start this trend towards
Mhm.
that direction of it becoming a healthcare hub. The less people we have going to community pharmacies, the less that transition will happen.
Right. I completely agree. And I've said this for a long time that community pharmacies, I think, will be the healthcare hubs of the future because of the access and because that primary care is pretty much dead from a physician perspective. Nobody wants to go into primary care. We are seeing family medicine residencies not getting filled, right? We're seeing people who are choosing more lucrative specialties. We're projected to have, I think it's 70,000, up to 70,000 primary care physicians short by 2034, which, that seems like a long way away. It's not. 2034 will be here in the blink of an eye, right? So the profession I think is most capable of and has the infrastructure in place already to step up and help fill that gap for primarily disease prevention are pharmacists. And that's really what I want to do at Script Health. That's what I talk to pharmacists about is that, hey, there is an opportunity here to carve out a space for us where other people are leaving that we are primed and ready to take advantage of.
I think I posted something on LinkedIn the other day. I said doctors will treat disease and pharmacists will prevent it. That's the future. And then obviously there were some physicians that got upset about that because they're like, oh, well, physicians prevent too. And it's like, that wasn't the point. Like the point is like, we could work together and trying to create this space. It wasn't talking negatively about doctors. It's just that's where I see the future going. Pharmacists playing a big role in preventative medicine.
hmm
Um,
And
great.
actually creating treatment plans
Yes.
because I know this as a physician pharmacist that, and I don't like to disparage my colleagues, but the knowledge that they have on pharmacology is horrendous. It's not great. And pharmacology is an art, right? There's so many times where I've seen new patients and I would just spend 30 minutes just going over their drug therapy, right? Trying to tease out, okay, what's doing what's necessary? Is this helping? Is there interactions? Is there drug-drug interactions, drug environment interactions, drug nutrient interactions, which is a huge thing that no one's really doing anything about. That's a huge area, I think, for pharmacists to cause some disruption is a lot of people don't know that medications can deplete key nutrients. So running those types of checks and interactions and then coming up with plans for those. So I see a role in the future where pharmacists are a lot more involved with that patient care because so many people are on a whole bunch of different medications. They interacting with each other. Their doctors aren't checking to see what's working and what's not. Pharmacists are already primed to come in and take over that area and help out patient care.
Yeah, I think that we need to learn that collaboration between us is the most powerful thing. We need to stop thinking like one person is trying to overpower the other. No, no one's trying to overpower anyone. It's just working together will be providing the best patient care possible. And that's my goal with like this podcast right now is I bring on a lot of physicians because I think we need more physician pharmacist conversations, whether it be positive and negative, just to put that out there that like we can collaborate with each other in a positive way and move the profession
Mhm.
forward on both professions, medicine and pharmacy. Medicine is going too. It's not just pharmacy, it's just pharmacy right now. You know, the PharmD degree is pretty fairly new. I think in 2000, it became like a thing where every school had to have a doctor of pharmacy degree. So that's 25 years. That's so new. So it's like there's
Mhm.
so much
Mhm.
more to grow. Um, Great health and wellness. Let's talk about that. We've touched a little bit about primary care. Obviously, DPC, concierge medicine, huge right now, like where physicians are taking into that role because they're just tired of insurance telling them how to practice and how to treat patients. So, talk to me about what your vision is for that practice. I know it's launching in April. What is your vision? Where are you at with the launch? And when do you expect to go forward with accepting patients?
Yeah. So I had a functional medicine clinic before COVID and got to the point where it was either, okay, I can scale this up or there's other things that I was wanting to work on because this was around the time with I started with Nimbus and Script Health and I was doing consulting, started my professional speaking career. And I had friends who scaled the clinic and that took all of their time. Like literally, it is a full-time, two full-time jobs to grow and scale a clinic. It's a massive endeavor. And so I didn't want to do that. And at the time, I didn't know of a business model that would allow me to have like a micro practice where I could still see some patients, but still be able to scratch the other itches that I have and the other things that I'm passionate about. And then the DPC model came out. And I started reading, started learning more, started talking to physicians in direct primary care, and realized this is the perfect avenue for someone who wants to have a micro practice because I don't want to build a big practice. And I don't want to have to hire other physicians and admins and do all that. I don't want to do any of that. Right. I just want to be able to see patients, help take care of patients, and practice the medicine that I want to practice. And unfortunately, insurance doesn't reimburse primary care very well, which is why your primary care doc has to see 25 to 30 patients and their visit slots are like 15 minutes. Well, the DPC model is a subscription and there are varying inclusivities in the subscription depending on the place, but some of them will include lab work in the subscription because having a provider account at like LabCorp and Quest, you get significant discounts, right? So that can be included. Some of them actually dispense medication. So they get authorization from their medical state boards to actually get medication from wholesalers and then resell and dispense that medication to patients. And oftentimes it's for a very competitive price for that patient off insurance. And it may be even included in their subscription or it may come as a small additional add-on. So this type of care, it gets rid of some of that surprise billing and things like that. You know exactly what you're paying for what services. You typically these are smaller practices. Most DPCs cap their patients at 200 to 300. While I was at a big box private equity owned clinic, I had 1,200 patients. So we're talking a fraction of the amount of patients, but now you really get to dive in deep. Like if I want to go see somebody in 2 weeks for something, I can. If I have the time now to really dive in, craft plans, and the way I envision this is really from a cradle to grave type situation where I want to prevent disease. That's my main focus. I want to work on cardiometabolic disease and I want to do deprescribing. Those are the three areas that I'm really passionate about. And so now I can work with people over the years because that's what chronic disease prevention takes. these diseases develop over years. It takes years of following up, coming up with a plan, monitoring, adjusting the plan as things come up. And being in the DPC model will allow me to do that. I'll probably cap at 100 patients just so that I can serve the patients the way I want to, but also have the time to work with Nimbus and Script Health and do the speaking and maybe a little consulting. I'm not doing much consulting right now, but those are all avenues that I'm really interested in. And I've finally figured out a way to have my cake and eat it too.
So I think I saw the video you posted about the practice, and in the link when you click on it, there was multiple states that you're offering the services to. Is
Hmm.
this something that you're looking forward to making it bigger than Dr. Harris, or is this something that you just, like you said, you just wanted to keep it just you and that's it?
Yeah, just me and that's it. I don't envision building out a nationwide DPC practice. I know there are those, but that kind of, to me, that gets rid of the community medicine aspect, right? And I think that community medicine, going back to that type of practice, that type of mindset around medicine is important because I hear the days where everybody knew the doctor. The doctor would make house calls. The doctor was, he or she was in the community. They were valued members of a very small and tight knit community. And I think that's the type of thing that I envision, to have that type of relationship with my patients. And realizing that I can't help everyone, but that's also why I have the content and I've got the free ebook, right, as a one to many type approach there. But then now I can take some people who really want to invest in their health, who are really passionate about their health, and work with them one on one in a long term relationship.
At what point do you think the average person will understand that insurance is built for major problems? Like, when you have a car insurance, right? You don't use your insurance to go get an oil change.
Hmm.
You
Hmm.
use your insurance if you get in an accident, or if your car needs to just get totaled and you need to get a new car, whatever it might be, or even house insurance. Like, if you're like, the faucet is broken, you're not using your house insurance to fix it. You're
Right.
using it for other reasons. And I feel like health insurance is that same way, but it's been marketed towards the fact of like you need to use it for all healthcare purposes. And to me, I see the future of DPC basically being the front of center of healthcare, and the insurance companies being for, surgeries or ER visits, ICU, stuff like that. At what point do you think the average person will understand that, and kind of by them understanding that will make a shift in insurance companies and how their model is?
Man, I hope it's soon, but that's a really tough conversation. I have a colleague who I was in residency with, and he's a young guy. He's healthy. And he said, I just can't pay out of pocket for seeing a doctor. And I've had so many people say that because they're already paying so much money for health insurance. They feel like everything should be covered. But, there's no other insurance that's like that. Insurance, by definition, is a risk pooling mechanism. It's a way of sharing risk among other members in the community. And I honestly think insurance worked better when it was at the community level too. And now it's, these multi global corporations, right, that are running insurance. So you lose that personal touch. When the insurance company was in your community, it saw the disasters in the community, and it really wanted to be able to help and fix that. Now we've kind of lost that, right? Same thing kind of with medicine and pharmacy in that aspect. So I try to tell people that all the time, that look, if you have insurance, insurance covers certain things. If you want to use it, that's great. But be aware that you're going to be hampered by the constraints of an insurance based system. Now, sometimes that works for people, other times it doesn't. And so the DPC model has come out of for people who insurance does not work for, who value being able to create a one on one relationship and not have someone else meddling in the care they receive. That's who the DPC model is for. And I think a lot of people don't realize that you can pay out of pocket for all kinds of different services. And it's, if you have a high deductible plan, it's going to be cheaper for you to do so. Right. So I had a couple years ago, I was having heart palpitations, need to figure out why. So I wanted to get an echo done. I, of course, hadn't met my deductible because, I'm young, I'm healthy, I don't take any medications. So I just go for my yearly checkup. They said, okay, that's going to be $1,500. And I was like, it's an ultrasound. Like, I've done it before on myself. That cost is astronomical. So I went to a local imaging facility that doesn't take insurance. And they said, yeah, we can get that done today. It's going to be $200.
Yeah, a couple
Perfect.
$100. Yeah.
Yeah. Yeah. Perfect. Let's do it. Did it, had it read by a cardiologist. The echo looked fine. Figured out the palpitations were stress related. Cut my caffeine intake for a little bit and they went away and it hasn't come back. Right. So I was able to take care of that problem myself for $200 and instantaneously versus if I had to go to a GP and they probably would have referred me to a cardiologist and the cardiologist would have ordered the echo and that process would have taken months and probably 10x the cost at least.
Yeah.
For that same level of service.
Do you think that now I'm just playing devil's advocate. Do you think insurance companies could ever get to a point where they try to stop DPC from becoming a thing because it's going to be basically taking away their business? If it becomes big enough where a lot of physicians, especially young physicians, are leaving school and they're like, forget working for the hospital. I'll just do a DPC and do my own thing.
Yep. I think they'll force them to readjust how they reimburse, especially primary care services, right? Because if primary care services were reimbursed correctly, then no one would need to go to DPC, right? Because as it spends now, I could spend an hour with you, go really in depth in your history, get to know you, come up with a plan that comes up that's in regard for both of us that we can do. We can set a follow-up. Everything's great. And the insurance company might reimburse me $70 for that. All right. And if I've got, real estate and I've got a staff that I have to pay and that reimbursement is not instantaneous, I probably would have to fight with the insurance company back and forth. And if I'm seeing patients, I don't have time to do that. So I have to hire somebody to do that. Right. It's just not a sustainable model for a small practice to do. And that's why you don't really see office family medicine or internal medicine practices anymore. So I'm hoping that we see more DPC in a way to get insurance companies to better look at how to reimburse primary care. My feeling is they probably won't care because those people are still going to need to be referred to specialists anyway, which is great for the whole system for certain things. So we'll see what happens. But the thing that I'm most excited about for the DPC model is getting physicians back in an autonomous position, getting that physician-patient relationship back to where no third party is meddling in that relationship.
Now, you were born in Cleveland and you lived in Belgium for 2 years. Why do you think the life expectancy in America is not as high as with some other places like Belgium? Like the Belgium life expectancy, I believe, is in the low 80s, and in the US, I believe, is in the high 70s. Why is that?
Yeah, there's so many different risk factors or reasons
Yeah.
for that. Part of it's nutrition, right? Part of it's physical activity. It's just ingrained in the lifestyle. So over here, it's all about money, 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 money. It's all about comparison. Oh, I need a bigger house than the guy next to me. I need a faster car than she has, and that stress drives us to just want more. We are very consumption focused country. And then you go to Italy, right? And everyone's smiling and happy. And you go sit down for a meal at a restaurant. Over here, you're basically rushed out the door so that they can get someone else in that seat to make more money, right?
It's so funny you said that because we just came back from Italy and we were sitting in the restaurants and the server barely comes up to you. You're just sitting there and they're just taking their time. You're in the restaurant for hours and they're not even trying to say, hey, here's the bill. In America, the bill comes to you without you asking for it.
Right. Right. And fast too. It's like your food and then the bill, right? Because they want to turn that table. And I remember just sitting there at the restaurant and, the server's talking to us, the maitre d' is talking to us, the chef comes out and talks to us, the owner comes and just pulls up a chair and sits down. And we were there for 3 hours, but it was really a great experience that everyone had, right? Because life like slowed down and we were able to enjoy each other's company and the good food and everything like that. And like that's just a microcosm of what life is like in a lot of other places. A lot of the things that stress people out here are not big deals whatsoever at all. And so, our stress levels are high. Our intake of alcohol is high. Our smoking rates are high. And so you layer all of these things together, and we don't focus on preventative care. We still have a lot of people who don't have access to care whatsoever, right? So it's a whole host of factors for why our life expectancy compared to other comparable countries has dropped. And there was a recent study that looked at the rankings of countries where we rank in life expectancy has dropped as well. And where we rank as far as morbidities, like how many diseases people have and the impact of these diseases, has dropped as well. So there's going to be so many things that have to happen, both from a policy level, from an infrastructure level, to like correct this, that there's no easy solution in sight.
The more I like speak to healthcare professionals through the podcast, and the more this, because some things you don't think about until you have a conversation with someone about it. It's like, man, feels like the healthcare system in America is just going to spiral. Those funnels that you just like it's going
Hmm.
just go like this, and it's just going down, 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 down. And it's just not being fixed, and it's so like unfortunate. Like you said, like in America, we're chasing the cars, this and that. And I saw statistics, and it said like, do you know how many billionaires there are in the whole world? And I think the number was like 3,000. And in America, it's you feel like getting $1 billion is so easy because you see all these social medias, you see the people with the crazy cars and the houses, and it's like, oh, like $1 billion, like everyone has it. But no, it's really like 3,000 people that are only billionaires in the whole wide world. So I think that concept is just it's crazy. I think things are just getting worse instead of getting better. Instead of it should be going the other way. It's like when we look back and we're like, oh, the 90s was such a great time. Like, why can't we say like today that now is such a great time? It's like, I don't know. I don't know what it is. Back in July, you started your journey in writing a book. I don't know where you're at with it now. You've mentioned that it took you years to come up with the topic. I don't think you've shared the topic, so I'm not sure if you changed the topic or you already stuck with the topic you had chosen. Do you want to give us a little teaser of what the topic of this book is about?
I wish I could. I thought I had settled on something, and
Ah,
then it's just I started outlining it, and it just didn't. I didn't feel it, right. And so I'm not a natural writer. It doesn't come easy to me. Speaking comes easy to me. It's just very natural for me. I love it. And so the writing a book would be a labor of love for me. It would be very, very difficult. So I have to make sure that it's something that I feel like a story that I couldn't tell through speech. And right now, I felt like I've been able to tell the story I want to tell on these stages that I've been able to speak on. So I still think it's something that's in the works. I'm kind of refining my ideas and where I want to go with it. I still think it's something that I'll do, but I feel like my current journey where I'm at is not done, and it won't be done until we've hit a certain point with like script health and with Nimbus. Once we get to a certain point, I feel like I can tell the story of everything I learned along the journey from like pharmacist to physician to entrepreneur to public speaker, right? And I'm just missing the final piece of the final story.
I could totally agree with you on that because I think my everyone has a crazy story, right? Not one person's story is the craziest. There's really motivating stories out there, and I've gone through my ups and downs, and I've always wanted to write a book about my journey. I think of it the same way. I'm like, I'm not there yet. I'm not at the finishing point. I'm not at the peak of the book. When you get to the book, it kind of starts slow, and then it gets
Mhm.
a little better at the top. Like I haven't reached that peak yet for me to have the book be exciting. But
Hmm.
just knowing your background a little bit, I can't wait till that book comes out because I'm sure you have some crazy, crazy stories. So I'll be looking forward to it. And if you want to come back and give us a teaser of what the topic is, you're more than welcome to.
I appreciate that.
You said something before that I've read it like 10 times since I heard you say it. I think it was in writing. I don't think it was on a podcast. You've said, in moments of strength, prepare for moments of weakness. And I think promise you, I think I've read that sentence before meeting with you like 20 times because I'm like, I'm just going so deep into it because it's so good and it's
Mhm.
so powerful. And it's funny, before I came on this, I was on Twitter and I don't know if you know who Layla Hormozy is.
Mhm.
I saw her tweet something that kind of resonated with what you said. She said, stops what was once easy. An amateur stops when what was once easy starts to get hard. A professional will do what's hard until it feels easy. And I feel
Mhm.
like that goes kind of hand in hand with what you said. Can you deep dive into, in moments of strength, prepare for moments of weakness? Because I feel like not only as a physician, pharmacist, a human, but also as a patient, I think that relates to a lot.
Yeah, I think that most people, when they don't succeed at what they're trying to do, it's not for lack of trying, it's for lack of execution. And lack of execution comes from an inadequate plan, right? So it's easy to stay on a plan when things are going well. When things are going well, everybody sticks to the plan, right? But it's like Mike Tyson said, everybody has a plan until they get punched in the mouth. And so what do you do when things don't go right? Well, most people just quit, instead of, because they think that their journey is just going to be linear, that things are just going to get better over time at specific intervals over, a time horizon. And usually that time horizon is terribly short, right? So whenever I started doing things, and this really came out of something that my grandfather and my mom used to tell me all the time. My grandfather's mantra was forge ahead, and my mom always told me prepare for exigencies. So that basically said, okay, have a plan, but move through the toughness, right? So that is the whole ethos of, in moments of strength, prepare for moments of weakness, because there are going to be moments of weakness. So what are you going to do? Like, predict what are your obstacles, and you can't rely on what somebody else says, because somebody else could be trying to achieve the same goal and have a completely different set of obstacles. You have to really be intuitive, know yourself, say, what are my obstacles going to be? Right. And then when I hit that obstacle, what am I going to do about it? So I'll give you an example. In medical school, when I was younger, I loved to go out. I loved to party. I loved to travel, and I liked making money. I liked having a job. So I said, well, all of these things are going to come into conflict because medical school is hard. How am I going to get through when I don't want to study, when I'm tired of studying, when I'm tired of being in the library? It's day 5 and I've been in the library 16 hours every single day. How am I going to get through that? And I came up with a plan. It said, look, moderation, still go to the gym, right? Because that's going to help you study. You're going to get out, you're going to see people at the gym, you're going to be social. And then it's okay to go out for like 1 or 2 hours. So what I would do is, it'd be like 8 o'clock on a Friday. I'd go to dinner with my friends, or I'd go hang out with my friends, go to a bar with them for a little bit. And then at like 11 o'clock, I said, okay, I need to go back to the library. Right. So something like that. I had a plan for those moments to try to keep me on pace. And I've taken that same type of thinking and applied it to everything in my life, knowing that something is going to go off the rails at some point in this journey. It may be off the rails for a while. It may not go off the rails for a while, but it's going to go off the rails. What are you going to do? What are your weaknesses? How are you going to push through that? How are you going to feel? What techniques are you going to do? Who do you need to talk to? What do you need to learn? And just doing that thorough analysis with any new endeavor. And that's helped me so well.
I think for me, what really helped is going to the gym. And I know for sure you can relate to this because you're a fitness guy. You got one of the things besides playing video games, you love going to the gym. So I think for me was when I started on journey, it was more so like teaching myself self discipline. Like,
Hmm.
going into the gym and like you said, sometimes you want to wake up and not do it, but like how can you tell your mind that like, hey, get up and go do it because of that feeling of after, of how you feel after. It's like at the beginning of your workout, you hate getting up, going down the stairs, getting in the car, going down the gym. But after an hour, when you're leaving the gym, you feel great. Like it's
Hmm.
like,
Hmm.
man, how could I even think about not going? I feel great right now. So I
Right.
think going to the gym and working out, it sounds so cliche. You hear so many people say it, but to me, when people say, "Oh, it sounds so cliche," those are the things you should pay attention the most to. The things that people always say that you hear them say, and people have to say, "Oh, that sounds so cliche." Everyone says it. Those are the things you should be doing because clearly those are the things that are working.
Right. The
Uh,
easy things, the consistent people underestimate the power of consistency over time,
yeah.
right? I talked about one of the biggest reasons I see people not succeed is their time horizons are way off. For example, my wife, she's started her career, she's worked her way up to being a manager. And in like 3 years, she's now managing two locations at the med spa that she works at. But her time horizons were way short. And I tried to give her, I was like, babe, 3 years into your career is nothing. It's really nothing. I was like, the MBA program I didn't accept anybody in until they were 7 years into their career. Why seven? Because at that point they felt like they had enough mastery of what they were doing in their industry to be able to help other people from other industries in their business. Right. So now she comes to me, she says, I didn't realize like I had the wrong time horizons. I didn't realize how long this would take. And I didn't realize that there would be up and downs along the way. I just thought if I worked hard and I was a good person, things would come to me. And it's like that's great that you work hard. That's great that you're a good person. But like I usually have like 7 to 10 year time horizons on things in this regard now because going through medical school, I knew it was going to be 7 years before I even saw a patient on my own, right? And that taught me how to really look at time horizons and adjust your goals inside of smaller windows for a larger goal later down the road.
I was talking to my wife about this, and we were talking about kids, and I don't know if you've ever know about the book or read the book 1001 Questions Before Getting Married. It's like a book. I don't know if you know who Patrick Bet David is, but
Hmm. Hmm.
he's recommended the book to like anyone that's like about to get married to read this book. It's basically 1001 questions that you go through. It's all the questions that you never want to talk about or they never come up until you're married for like 5, 10 years. But this book brings it up dead center from the beginning and you talk about it with your significant other. And one of the chapters is like having kids and stuff like that. And I forgot what the question exactly was, but it was something along the lines like, what would make you like a good father or what would make you a good mother? And I think for me, like my background and all the failures I've had is what's really built me to become like to be able to push through those hard times. Like I've gotten in undergrad, I got kicked out of school because of academic suspension. I had a 1.2 GPA, and I got rejected from pharmacy school twice. I got into residency and then I got kicked out of that residency because I didn't pass my boards on time. Like I've gotten so many pushbacks that I feel like all those failures have been able to lead me to be able to I wouldn't call myself successful at this time yet, but be able to be where I'm at today, to be able to pass on that knowledge to my kids or to other students to be able to show them, hey, like those low times are what's going to build you to be able to be a strong leader. If you don't have those low times, you're never going to be a strong leader. No one ever made it to the top by just climbing the ladder straight. That ladder had to break at some point and you have to start from zero. And those
Hmm.
people are usually the people that are the most successful ones because that feeling of going back to zero and picking yourself back up, that's what makes you like super, super strong, in my opinion.
Yeah, and I'm going to push back and say you are successful. So don't ever say that you're not successful because there are people who gave up along the path that you've taken. Right? You
Yeah.
endured, you persevered, you had a goal, and despite the setbacks, you achieved that goal. Right? So to me, I think we should redefine success. Success to me is there's an aspect of perseverance. Were you able to make it through the obstacles? It's not so much of did you achieve the goal, because you're not going to achieve every single goal that you ever set out to have, right? But did you give it your best to try and achieve that goal? Did you persevere through the obstacles? If the answer is yes, you were successful, because God's not going to give us everything, right? And did you learn something along the way? Like you mentioned, like every journey, every goal that I had that I didn't achieve, I still learned something. So that's successful. I still gave it my best shot. That's successful. And then, are you waking up every single day in a way that provides you happiness and joy, where you're meaningfully contributing to society? That's success, right? So if the guy or girl is a janitor at a high school and they love it, and they're the person who all the kids love, and they provide sage advice for the kids, right? And they're sweeping the floors with a smile on their face. That person is successful, right? Because they're doing something that they love. They're meaningfully contributing to society. Where most of the world would say they're not successful, where they're a janitor, I would say that person is a rousing success at what
Yeah.
they are trying to achieve every single day.
I think, yeah, I totally agree, and I appreciate you saying that. But I also like, I think we need to get away from the word success being attached to titles. I think
Hmm.
that that's where the issue is. It's like, in your school, I want to be a director, I want to be a manager, I want to be a CEO, and all of this. And I could say I could blame myself for this. Like in school, like I've always wanted to be a CEO, and that my mindset has always changed. Like being a CEO of a healthcare system is not what I want to do anymore. And I think because that's what we're always put in the limelight for, like the social medias and everything. That's what they put as successfishand it's
Hmm.
like, that's not success. And to me, to piggyback what you said, like the word burnout, in my opinion, and I would love to hear yours, pushback, feel free. I don't believe in the word burnout, because I believe burnout, it happens when you're doing something that you don't really enjoy. Like I have a full-time job, I have the podcast, I have a newsletter that I write, and I'm starting a business on the side. Someone might look at that and be like, man, you're doing so much, you're gonna get burnt out. But to me, it's like speaking with you, I enjoy this. This to me, this is
Hmm.
not me taking time and burning me out, and then I have to go work after. I
Hmm.
enjoy doing I love being a pharmacist, working at the hospital, talking to patients, working alongside my colleagues. I love doing that. Being at work, my schedule is from 1 to 10 p.m. So it's like someone might look at that and be like, man, don't you get tired? I'm like, I mean, not really, because I love those 8 hours that I'm there. I love
Hmm.
what I'm doing. So that's my thoughts on burnout. I would love to hear yours, because I know it's such a hot topic that everyone always speaks on and puts out there.
Yeah, absolutely. I agree with that. So there are times where, working on these businesses, that I've worked 16, 17-hour days, but it didn't feel like it. And Brittany would come to be like, hey, you need to stop. And not just because, like, she was worried about me, or like I was working too hard or missing time with family or things like that, but because it's rest and recovery is part of the process, right? And so I never felt like I was working too hard during those days, because I was working on something that I was passionate about. And I think that everyone needs something on the side that they're doing that's a passion project, that's outside, hopefully, of themselves. Like, I think everyone should have something they're doing where they're meaningfully contributing to others. So whether that's you're volunteering on the weekends, or you're helping with trash pickup in your community, something like that, right? I think those things are very important for helping us prevent quote unquote burnout, because we're thinking of things other than ourselves, and we're doing things that help people contribute. I think a lot of burnout comes from when you just feel like what you're doing doesn't matter, what you're doing doesn't impact anything, right? So how do you get out of that cycle? I think is really important, and that could be different for every single person. But I've always found that helping other people has, no matter what place I'm in my life, has always been a way to bring me back to a place of joy and gratitude.
Yeah, I think one thing that every time I'm working, if I have to go a little bit out of the way to help a patient in any way, even if it slows down my work, I always do it, because that feeling of, like, I think I did something this past like 2 weeks ago, and one of the pharmacists reached out and said, thank you so much for going out of your way to do this for this patient because like, and then to me, that sentence right there is so like fulfilling that like someone is like understands and sees that you actually care for the patient. And I always try to put it like, is that my mom? Is that my dad? Is that my,
Hmm.
I don't have any siblings, but if is that my sister or brother? I always try to look at it that way. It's like sometimes when we work for a health system, it's always, you know, metrics, metrics, metrics. And sometimes you got to look back, like we've talked about earlier, like it's a patient at the end of the day. So you need to look at it as that way rather than, hey, I need to finish my duties to hit these numbers or metrics or whatever it is.
Hmm.
Um, you mentioned God really briefly just now in your conversation. I know I think 4 years ago we spoke. You briefly touched on it, how you know your beliefs weren't as strong as it is now. How has God played a big role in your success, in your thought process, in your viewpoints? Because I think that's something that a lot of people don't talk about. But for
Hmm.
myself, like I think I've gotten closer to God, and I think that when you are close to God and you feel like you know someone has that support, which is what God is, and it makes you push through those hard times that we talk about.
Hmm. Yeah, definitely. I always felt like God was always there for me, and I could always call on Him and get support. So there's a lot of dark days in residency. Every doctor you talk to will say some days are just brutal mentally, physically, spiritually, and calling on God definitely helped. And getting closer to God after I got out of residency, I was lost. I felt like I wasn't fulfilling my purpose. It brought me onto the track that I am now. And it's opened up so many doors for me now that I feel like I'm walking into the calling, into the purpose that he had outlined for me, not what I had wanted for myself. That I'm in rooms that I shouldn't be in. I'm on the board of a university. I never imagined that I'd be on the board of a university. I love education. I love helping students. And now that's like the highest level I could possibly help students at, is helping to steer and manage a university. And because of that, I've gotten to meet people like Ben Carson and talk with them. So it just all the things I never imagined my career would be at this point where I'm at now. I never imagined I'd be able to help people on a global scale just, by typing up a few words and shooting a minute 30 long video, right? And all of that is movements of God. My wife is a movement of God. She's been the best thing that's ever happened to my life. Everyone always says it's the most important decision you'll ever make, giving your life to Jesus Christ. The second one is, who do you marry? And my wife is a God-fearing woman. She is from God. There's no way I would have found a woman like her where I was at that point in time in my life without God. So I owe everything to his grace and his mercy. And I'm really excited about the future, bringing a son into this world, teaching him about the Lord and about kindness and mercy and discipline and integrity. Those are the three values: discipline, integrity, and kindness are the three values that I try to live my life by. And all that comes from God as well. So everything can change in the moment once you just open up and you say, not my will, God. What would you want me to do?
Yeah. I think I totally agree. I think when I look back at all those trials and tribulations that I had, and I'm like, there's no way out that was me like alone acting on those and being able to pick myself up. It was God pushing me and supporting me to be able to push through and go through those hard times. So I think if you're someone that's like struggling with something, I think go like bringing God into your life will definitely help you go past that obstacle, whatever it might be. Two more questions. I know we got to an hour so far. I hope people are still listening because I got a fun fact to tell you about Dr. Harris. Now, did you know? I know you knew Dr. Harris, but the audience, the people that follow you, did you know that Dr. Harris was in a commercial for Old Spice when he was in college? Yes, and it's look at him smiling. You didn't think I was gonna bring that one up. Tell me about that experience. What was that about, and how did you end up getting into that?
Oh man, that's wild. I actually have the commercial on a CD somewhere in my
I
office.
I was trying so hard to find it, and I couldn't find it.
It's pre like everything on the internet. This is even like pre MySpace, I think was when I did the commercial.
Oh, wow.
So it's a random story. And I was always one who never said no to an opportunity. I was like, sure, I'll do it. And so we're sitting in pharmacy school in between classes, and a friend of mine had heard that they're auditioning people for an Old Spice commercial at one of the buildings on campus. And I was like, okay, I'll go. That sounds like a fun time. So me and my buddy Adam went, and we auditioned. And so there's a group of, I think it was two women and a guy in there. And I'm just like hamming it up. He's acting like a character, right? Just trying to be funny and witty and just outgoing. And so they call me back and say, okay, we want you to be part of this campaign. So at the time, what they did was they went to like 20 or 30 different colleges, and they had three people there interviewed to be the Old Spice president. And so what happened was they had us just doing a whole bunch of stupid stuff during a UT tailgate. And so I remember I went up to one older woman in a wheelchair, and I whispered down to her, I was like, you could be in my special interest group. And everybody starts busting up laughing. There's like a shower scene where I was like kissing my bicep. Like it was just a riot. And I actually won for UT and got to compete on the national level. And so the videos were all on Old Spice's website. They were voting for the president, and the winner got to go to the Pro Bowl. And I ended up coming in like second or third, right? So just outside of getting a trip to the Pro Bowl. But it was a really unique experience, something that I could say that, hey, I was a professional model for a day and did a commercial with Old Spice.
I think you definitely should reach back out to them. And if they've seen the journey of you from then to now, they will be more than happy to bring you back on for another commercial and to do it this way. Hey, Kevin Hart is part of that. I think once he's part of the Old Spice, he does the Ice Bath show with Old Spice, I believe. So, hey, you never know. You might be full circle being a model again.
Yeah, I mean, I wouldn't say no. It would be definitely an interesting opportunity.
Hey, you never know who's watching, right? One last two last things. Can you give some advice to pharmacists? At the beginning, we talked about, how why aren't pharmacists like seeing the vision and seeing all the things that we've been talking about? Not all pharmacists, but some. Can you give some advice to pharmacists as a pharmacist, as a physician? I think you hold so much value towards educating pharmacists because you have that MD degree also, because you see both sides of it. What are some advice you give to someone that's in pharmacy in the middle of this growing profession, role expansion? What advice would you give to someone that's trying to, I don't want to use the word successful because obviously we're breaking down what success means, but I think you get the gist of what I'm trying to ask you.
Yeah, definitely. I think so. In pharmacy school, if you're in school, pharmacy or med school, the first thing I'd say is keep your options open. Talk to every single person that you can possibly find in an affiliated position close to what you do, right? Because you just don't know what's out there unless you look. Leverage LinkedIn. LinkedIn is a great way to connect with professionals. If you're a student and you just reach out to people and say, hey, I'm a student, I'm really interested in learning more about what you do, you have 5 minutes to chat with me, you're going to have a high success rate of people reaching out to you to just chat about what they do, right? Because everybody remembers when they were a student and what that's like, right? So I love hearing from students. I talk to students all the time about my journey. So that's what I would do if I'm a student. If I was a professional, what I'd say is if there's an itch that you have, if you feel like your current job isn't meeting it, look for ways that you can either incorporate that in your current job, so be an entrepreneur, or look for ways that you can start doing that outside of your current job. The great thing about healthcare is if you aren't one of the students who made the mistake that I did, where I brought my cost of living up to my income, if you still maintain a low cost of living when you get out and you figure out this is not what I want to do, there's plenty of part-time work available. And that's a great way to start building something of more in line with what you want to do. I did that for several years where I worked part-time while I was working at Nimbus and Script Health and crafting my speaking career, right? And the final thing is just leverage your networks. I think in business school, they tell you about the value of your network. In medicine and pharm, they don't. Your network is by far the most valuable tool you could ever have if you cultivate the right network. Everything I do now I'll use Script Health for an example. How I became the CMO of Script Health is because of LinkedIn. The founder was looking for a physician pharmacist and found my content and said, "This is exactly what I need to help me with my vision." We met and I said, "This is crazy. I've been thinking about this too. This problem that you're trying to solve, I'm in." So that all came from a network I developed. So those are just the kind of the three things that I would say, depending on where you are, that have been the most invaluable to me.
Yeah, I think I can definitely co-sign what you just said. I mean, we met when I was a student, and I think I reached out to you through LinkedIn when I was a
Mhm.
student too. And we met, and 4 years later, and we're still connecting to this day. And I think that I would echo what you just said as a student is leverage the fact that you're a student. And on the bottom of your email, the fact that it says student, I think if there's a study on this, there's probably such a higher probability of someone replying to you or opening your email just because it says you're a student on the bottom of
Mhm.
that. So leverage that because I definitely did with the podcast that I had when I was in school. Like the people that I sat down with and had on the podcast, I would have never imagined I would sit down with the Surgeon General of Florida on a podcast as a student. Like, and
Mhm.
that was, like, so unbelievable. So, definitely leverage that and, take advantage of it. If I was to go back to high school, pharmacy school, undergrad, and spoke to your best buddy, your favorite teacher, professor, and said, "Who was Richard?" What would they say?
So in high school, I actually won the award. My high school is pretty big. We were at the time the biggest division in Texas. I graduated 936 people in my class. For senior awards, I won most thoughtful. So it was a nice guy award, and that was who people thought I was. They knew that I was a dependable guy. If they had a problem or if they had an issue, they could come to me and they would get compassion. Now at the same time, I was super sarcastic and made fun of everybody, but they knew that that wasn't like that was just me being lighthearted and joking around. But if there's something was serious, that they could come to me and I would be there for them and I would try to help them in whatever way possible. And I think that that part of me is really what guided me onto the career path that I am today. It's just being dependable, being thoughtful, trying to help other people, and just, really thinking about things and about people's situations and what I maybe what I did to make things worse or what I can do to make things better.
Awesome. Well, on that note, Dr. Harris, I'm gonna leave the last words for you. I can keep going for another 3, 4, 24 hours with you. Um, very much respect your work, what you've done, your journey, what you're gonna do, what you're doing currently. I will be looking on LinkedIn and Instagram on that book that's about to be coming out. Hopefully within the next 4 years. Hopefully we don't do this every 4 years. We could do it every like year, but you never know what goes on. But maybe this is the path. Every 4 years we're gonna check back in and see
Mhm.
and where you're at, and we're gonna put all the videos together to see your growth of your journey. So I'll leave the last words for you.
Yeah, I just want to say thank you so much for having me on the show. I appreciate that. It's been great watching you grow and step into what God has called you to do, and watching your journey from now student to professional entrepreneur to soon to be husband. You're
Mm.
and watching you hit these milestones, and
Yeah,
that's really cool to see people in the network step into their faith and become more than what they were over the years. So kudos to you, and I really appreciate your time.
of course. Thank you so much. And thank you so much to everyone that was tuning in.